How are we? How are we doing? Okay, we're recording. Looks like we're going. People are coming on. People are logging in. This is going to be good. Things will be a little different today. We're mixing it up. And we'll start here. Well, it's 1 o'clock. I'm waiting for a quorum. Tori just came. Bill's here. Krista's here. Linda's here. Larissa's here. All right. How many do we need? I need somebody to tell me when we have a quorum. I can't remember. He's all here. I think we have a quorum at this point. David's here. Thanks, David, for coming in. Jeannie's here. Excellent. We're going to begin this. I'll give it another 20 seconds because people are popping in pretty rapidly. So, and then we will begin. I was trying to figure out how to set up a third screen so I could see the call list queue and all that. Yeah, we're up to 100 participants, so it's growing rapidly. We're scaling up quickly here. So I'm going to give it a few more seconds and then we'll start. Thank you all.
In the meantime, I've received an important announcement that it's Marky's birthday today.
Happy birthday, Marky.
It sucks to turn old, but I just got a beautiful bouquet of flowers. So I guess it's wonderful to have a birthday.
I've heard it beats the alternative.
Well, you know, I'd rather be vertical and have a birthday than be horizontal.
Okay, I think everybody's here. Jordana, are we okay to start?
We are.
Okay, so I'm calling this meeting to order. This is the Pitkin County Board of Health. I think that looking at the review of the agenda, do we have any additions to the agenda?
I updated the staff recommendation on the agenda.
Okay, great. We'll take note of that. I wanted to discuss previous minutes if we need to make any corrections. If anybody has something they want to add to previous minutes, otherwise I'd entertain a motion for approval.
I move approval.
Thank you, Dr. Kurt and Linda. I see a second. So all in favor? Aye. Raising hands for that. All right, moving right along. We're already ahead of the game. So up next, we have Jordana, Josh, and Dr. Kim Levin giving us a COVID-19 data update and staff policy recommendation following current data and case trends, for rescinding the public health order on February 22nd. It's on this calendar. So please take away, Jordana. And then if our host could let John Peacock in. I just got a message that he's here, but he's not on the panel. I'd like to bring him in. Okay, take it away, Jordana.
I think I can get started, Greg. Looks like Jordana's on mute still. So is that okay, Jordana? Okay, perfect. And so a few slides and then I'll pass it off to Jordana. Wanted to share just where our current case rates stand. So this graph is a little bit confusing, but what we tried to do is look at the actual incidence, so the actual number of cases that got reported to us compared to what we think actually happened. So the dotted lines there are the actual number of cases that got reported to us, and then the solid lines are the number of cases we think actually occurred. So you can see that we think we missed probably about half of all cases, just because people either got tested using an at-home test or they just didn't test at all. So what we did see was that we saw a surge in adult cases that really took off right around the 19th or 20th of December, followed by an increase in pediatric cases, which is that teal looking line. And then those both peaked right around the 8th or so of January. And then we've seen this decline in incidence among both of those groups. With our pediatric cases remaining higher than our adult cases at this point. So our current incidence right now among children is at 738 cases per 100K, whereas among our adults, it's about 315. So we are seeing a higher case rate in children currently. And then if we look at what we actually think is occurring, right now, we think our incidence is about 1741 in children compared to 848 in adults. So again, pretty high rates of disease still, even though we've seen a very large drop off from early January.
Josh, excuse me. I don't want to, if I could jump in, just if you could describe the current known versus the estimated and how CSPH has modeled that a little bit on that, just so we can understand how they arrived at that.
Yeah, the bottom part here, Greg. These two, yeah. So we used a formula which took into account the number of cases that we knew about based on testing, as well as our positivity rate. And so we are estimating here locally that about 42% of all children in the county likely had an Omicron infection, compared to about 39% of adults. And that would be as of February 9th. The Colorado School of Public Health, they did some modeling back on the 26th of January, and they were estimating that about 42% of all Coloradans had been infected with the BA1 subvariant of Omicron by January 26th. So we actually think that we're probably a little bit behind that modeling, again, likely due to high vaccination rates and other mitigation factors that we've had in play. So that is where those numbers came from. In terms of hospital admissions, just wanted to highlight this point. We've had 15 hospital admissions that have occurred during the Omicron wave, so since December 15th, which is a rate of 0.6%. That is compared to the Delta wave, where we had a hospitalization rate of 2.2% with 11 hospitalizations. And wanted to just note that, we talk a lot about Omicron being less severe, but because it is more contagious, it means that we end up getting a higher number of cases and a higher number of hospitalizations, although the rate of hospitalizations is lower. So just wanted to make that delineation there. So does that answer your question, Greg? Anything more on that slide?
Yeah. Thank you for that.
Sure. Next slide, please. So just wanted to share just two quick things on the Omicron variant, especially in light of this emergence of the BA2 subvariant of Omicron. So Omicron has four known sublineages. There's BA1, BA1.1, BA2, and BA3. We have only identified BA1 and BA1.1 here in Pickens County to date. However, BA2, which is this different sublineage of Omicron, is starting to emerge in many other parts of the world and is actually predominant in several countries in Europe, including Denmark and the Netherlands. And we're seeing that same trend hold true here. So this graph on the bottom left, the purple is BA1 or BA1.1. And so you can see really since about the middle of December, we've seen, again, that increase in prevalence of the BA1 variant. That pink on the very top there, that's BA2 starting to emerge in the data across the country. It looks really small now, but if you look at where the purple was when Omicron was first starting, you can see those numbers look pretty low, but they rose really quickly. And so the expectation is that BA2 will become predominant worldwide, which would include here in the US, and that is per the World Health Organization. They're thinking in the next 2 to 3 weeks, we could see BA2 become the most predominant variant. Reason why it's important to discuss is because BA1 and BA2 are very genetically different. So although they're still a part of the Omicron overall variant, they're very different from each other genetically speaking. There are many more mutations on BA2 than on BA1. So really the concern here is whether or not BA2 can infect or reinfect people that had BA1. There are some reports of reinfection, but it's hard to know how common it will be. But Denmark and then Israel have both noted that people that had BA1 could be reinfected with BA2. So obviously, in terms of trying to model what's going to happen moving forward, a lot really depends on whether or not BA2 can reinfect people. If it can reinfect people, right, then a lot of the modeling that we're trying to do moving into the next couple of months, may not be as accurate. If reinfection rates are low, which it looks like may potentially end up being the case, then we would see less disease moving into the next at least month or two here. But that's really the question, and a lot of studies are being done to understand whether or not BA2 can cause reinfection, but there's just not a lot known at this point. The middle graph here, I just wanted to highlight this, not really specific to BA2, but I thought it was important. This, it's hard to see, and I apologize for it being so small, but what this graph looks at is how long it has taken us in the US to increase from having an additional 100,000 deaths occurring due to COVID-19. And again, just wanted to highlight that with Omicron, again, although it is, we're seeing a lower rate of hospitalization and death overall because of how contagious it is, we're seeing the deaths accelerate. So we actually saw 100,000 deaths. So we went from 800,000 to 900,000 deaths in the US within a course of 50 days, which was quicker than what we saw with the Delta wave. So, we are seeing deaths continue to accelerate, even though overall, right, we're seeing less severe disease in the population. Then last thing I wanted to highlight with Omicron is this graph on the right-hand side, which shows hospital admission rates by age group. And so, we've had our younger age group, 0 to 4-year-olds, because they are just more vulnerable in general, along with our 80-plus-year-olds. Overall, throughout the pandemic, we've seen a higher rate of admissions with these individuals. So South Africa posted this graph, and what they're finding is that in that naive group that have not yet had opportunity for vaccination, they're actually seeing the highest rate of hospitalization as compared to what we were seeing with Delta. So just another point here that monitoring pediatric infections and admissions, especially in that really young age group, 0 to 2 or 0 to 4, remains a really important thing to be monitoring and keeping an eye on. And then next slide, please. So the last thing I wanted to share is really just around vaccine efficacy against disease with BA1 and with BA2. This came out of the UK. And essentially, this is only looking at symptomatic disease. So what's the likelihood that you'll develop symptoms and test positive for COVID? This does not look at hospitalization or death. But what they found is that individuals that only had 2 doses, and this would include AstraZeneca, which is the vaccine they have in the UK, they found that 25 weeks after that second dose, there was only about a 9% efficacy against BA1 and a 13% efficacy against BA2. So essentially, we're seeing individuals who only have those 2 doses. They are much more likely to develop symptomatic infection. Again, hospitalization and death rates are likely much more protected against those who have those 2 doses as well. But what they really found here is that it takes those 3 doses against BA1 and BA2 to provide a full level of protection, or a much higher level of protection. So individuals that had that 3rd dose, they had a vaccine efficacy of 63% against BA1 and 70% against BA2. So what the researchers found is that there's no difference between those numbers. So 63 and 70% are close enough statistically that they found that booster doses are protecting people against symptomatic infection at a very high rate. Again, just wanted to reiterate here that, if we're looking at hospitalization and death numbers, it would be higher. This is simply looking at likelihood of developing symptomatic disease. So wanted to share that as well. This came out recently, and again, just highlights the importance of individuals getting that additional dose. So those are my slides. I think, Jordan, I'll hand it off to you.
Thanks, Josh, and thanks for jumping in there. I wanted to share the slide that details Aston Valley Hospital's status, which has in the past few weeks moved back to comfortable. If you all remember, back January 7th or so, the hospital was up into the red concerning level because of a lot of different pressures. One of the biggest ones being so many essential healthcare workers out. I think this was something that we didn't quite expect with the next variant, just having such a high incidence rate in the community. There was really a challenge in staffing there. Hospitalization transfer capacity was also an issue at that time. And just want to really applaud the hospital for managing their employees shortage and continuing to provide care to the community through the surge. And now we're really able to report that the hospital is at that comfortable level. Next slide. I wanted to share is around, the next couple slides are around some modeling that CDPHE has been doing. They shared this back at the end of January, showing that when they looked at hospitalizations, they were really looking at how with the peak of Omicron in January, understanding that even if we had a change in transmission control, they continued to predict that the rate of hospitalizations, the number of hospitalizations, would decline rapidly. And so, now knowing that we are here in February, we are continuing to see these projections play out, and across the state, our hospitalizations are dropping as well. The next slide is Greg, let me know if you have trouble hearing me. It's telling me my internet connection's unstable.
We hear you. It's a little broken up, but keep going.
Okay. So the next slide is showing that back again, January, when this end of January, when this was run, that even if we had a change in transmission control, what were we going to expect in terms of incidence rate, prevalence, excuse me. So again, even in all of these different scenarios, we were looking at a swift decline in the prevalence of Omicron. And again, just to point out, this is what is expected only in with relation to the current variant of Omicron that we are seeing. But all models were really pointing to this swift decline as we move to the end of February. Next slide. I wanted to share were just some key takeaways. So CDPHE was estimating that approximately 42% of Coloradans had been infected with Omicron by the end of January. The infectiousness and immune escape of the Omicron variant led to very high levels of infection. We saw that. They estimated that Omicron has infected, by late February, they were estimating that 65% of the population may have been infected with Omicron, and that by the beginning of March, there would be very few people susceptible at that point in time. So we move on to the next slide. We wanted to give a chance for Dr. Levin to share some thoughts.
Yeah, hi, thanks Jordana and Josh and the Board of Public Health. And can you hear me okay?
Yes.
Okay, great. Yeah, I don't have any specific slides today. I just wanted to take a couple minutes to make some broader comments. And first of all, thank everybody for this important conversation today. Thank you, Josh and Jordana. You do a great job with the data. I'm not going to present any additional data. I just wanted to make some comments. This conversation today, we're looking at the data that's coming down. Jordana, thank you for mentioning the matrix of the hospital is in a better position now. We are just coming down from Omicron, and we're in this position now as a community to discuss the mask mandate that was put in September. And, this is really weighing the data when you create policy and with all the other emotional and psychological needs as we step forward. We know that masks work. We know that they decrease transmission. We know that better masks decrease transmission more, but in general, we know that masks work. And so when we repeal an order, sorry for a second here. So the conversation today is, how do we weigh this goal with masks? And just to bring it in bigger perspective, this conversation of being endemic and going into an endemic situation. Hold on a second. Okay, yeah, sorry. There's so much conversation in the news and everybody's reading about, are we endemic? Can we be endemic now? Can we take steps faster to do that? And what does that mean? And endemic really means that you're maintaining a baseline in a community of a disease. So for instance, endemic, so malaria is endemic in certain parts of Africa, but it's not endemic here. So how do we move forward in an endemic situation? And I think we are not there quite yet. We are making steps there. And I just really want to thank everybody in the community who has continued to wear masks throughout this public health order, and to let you know that you have made a difference, that you have decreased transmission, you have probably decreased deaths, and that masks do work. So if we're at a situation where we take masks out, or we're voting on this and we're having this conversation today, and thank you everybody for your comments, very important comments and input into the conversation today. If we look at previous pandemics and we learn from history, we know that pandemics end, and we know that this pandemic is going to end. Again, we want to take patient, careful steps to that end and not make any steps that are too quick to do that. So what have we learned? If I think about what have we learned about this pandemic so far, and how can we move forward with these lessons that we've learned? We have increased awareness about how we spread infectious diseases. We're all interconnected in this, in an infectious disease, and it's critical that we continue to take personal responsibility about how we affect other people. So if we vote today to repeal a mask mandate, I ask those to respect people who want to continue to wear masks, or respect organizations or businesses who decide to continue to have mask mandates. You never know a person's story. You don't know if somebody's immunosuppressed from an autoimmune disease. You don't know if they're going home to a family member with a high-grade cancer and they need to protect them. So please respect others, respect schools that may decide to continue mask mandates, respect organizations and businesses that may decide to do that, as we're in this, what it looks like to me as a transition period. Hopefully we're taking these exciting steps forward, and just have patience and to really support public health. And public health is there to protect the health of others. There may be, let's say we are getting out of this into entering an endemic situation. There may be flares, there may be outbreaks, and public health's job is going to be to to really address those. And please respect and support public health in those efforts. So again, thank you today for all of your input, for this important conversation that we have, for these thoughts about becoming endemic, but we're not there yet. Knowing that masks work and respecting others who continue to want to wear them. We look over the history of previous pandemics. We look at like influenza, which has become, we had the 1918 pandemic of influenza, and that ended, and this too will end. But there's been courses over the years of little smaller pandemics of influenza, and then public health job is to really address that. And I see COVID going forward. We're not going to eradicate this like smallpox was eradicated by vaccines. Smallpox and polio was eradicated in the United States. So we have some viruses that are completely eradicated. I think COVID is going to be here to stay. And as Josh pointed out with the third booster, my vision and thoughts are that we likely will have continued shots over the years, and it may be, the vaccinations may be annual, it may be like flu in some ways, but don't think of it as a second or a third dose. Start having thoughts about, this is moving forward. We're probably going to be getting annual vaccines or some type of vaccines in a regular amount, and that increases immunity and it helps with disease transmission and overall disease burden. And we think about some other viruses like measles, which is a childhood vaccination. And there was a measles outbreak in Colorado in Colorado recently, and with pertussis as well. Pertussis is every 10 years. That is a recommendation for vaccination. And there was a pertussis outbreak in 2012. RSV, for instance, does not have a vaccine. So I think we're lucky with COVID. We have a vaccine. I think we're making important steps. And just to learn from history that pandemics will get over, and to have patience. And again, thank you, everyone. Thanks for my comments.
Kim, Dr. Levin, Kim, thank you. It was so nice to be able to speak informally. Thank you so much. And to reiterate, forgive me, but I'm going to repeat a few things you said. Masks do make a difference. I think that conversation's pretty much over. Masks do work and have worked and have helped us. Pandemics end. It's sure great to hear you say that, but maybe it will require some more patience. And the respect necessary for masked people or mandates in businesses or schools. If they decide that that's how they're going to stay safe, we need to respect that. And I will, expect that from our population. We have to respect each other, and that is super important. And then also just respecting the work put in by public health and all the volunteers we have here today, all the staff, the workers who are participating here. And then finally, that the vaccines could be ongoing from this. And I think that's a good thing to tee up for the rest of us. Jordan, unless you have something else to add, I'm going to move on to our partner updates. I see David Bowes and Dave Ressler, I believe, is possibly here. Yeah. Are we ready for that?
We're gonna head into the policy recommendations, and then we'll go over to our partner.
Sorry, I jumped ahead. Oh, that important part. Okay, go ahead.
Thanks. So as we move forward into the policy recommendations, I just want to take a moment to thank the community and our partners for all they have done the past 2 years for what was needed to respond to this pandemic. The community has pitched in to help in a multitude of ways, has provided thoughtful feedback, and has done what was required of them to slow the spread of the virus in order to maintain our hospital capacity, keep schools and businesses open. I also want to thank the Board of Health for all that you've done throughout this unprecedented time, and to the commitment you've made following the science and data in real time and making the best decisions at the time that consider the physical, mental, and economic health of our community. As I put these slides together, it was really an opportunity to reflect on how far we've come together, and as we enter into this next phase of how we understand living with COVID. I'm excited to be able to talk through that next phase and continue to be able to work with this community. So the next slide, please. As we think through where we are and what we consider as we consider a policy recommendation, we know that vaccinations and immunity are very important concepts. We have a high vaccination rate in Pitkin County. We know we've got 83% of our census population here fully vaccinated. And as you can see on the right side, really high levels of vaccination among all of our age groups. Immunity to Omicron is high and rising. The CDPHE estimates that I shared, they approximate that 80% of the state population will be immune to Omicron by mid-February. And again, just thinking about how long we've had to be able to get vaccinated. Adults became eligible at the end of 2020, and boosters have, or additional doses have become available over time as well. Those that were 12 to 17 became eligible in May of 2021, and boosters were approved for that group after 5 months after the initial doses. Children 5 to 11 became eligible back in November of 2021, and boosters have only been approved for moderately to severely immunocompromised individuals in this age group. And then we are expecting 6-month-old to 4-year-olds to be approved by the end of February. So vaccination continues to be protective against transmission, as well as extremely effective against severe death and disease, when Josh shared some of those figures earlier. Next slide, please. When we think about how far we've come, our hospital capacity currently is comfortable. We see in the Omicron instance and death modeling that shows a decline in Colorado, even with decreases in that transmission control. So transmission control are the things like masking, distancing, and policies that might support those. Omicron, we know to be highly transmissible, but less severe than Delta. And Josh shared previously the hospitalization rate with Omicron, which is much lower than that of Delta. And finally, we have effective treatments for those at risk of severe outcomes, which is a fairly new piece of the pandemic puzzle here. Next slide, please. When we think about masking, we know that masking in our schools has allowed us to keep schools operating in person throughout the peak of Omicron, and universal masking was able to allow us to prevent quarantines this school year. As Dr. Levin shared, masking continues to be a mitigation strategy that we know to be effective at reducing the transmission of COVID. And I suspect that that's going to be a tool that we're going to continue to use in the future. We know that a high quality, well-fitting mask is most protective, something like a KN95 or an N95. And currently, we've got a readily available supply. So free KN95 masks that protect the wearer are available at local libraries, as well as child-sized KN95s are available in schools, all of these for free. The community, we know, is concerned about the mental health impacts of masking, especially among children. I think that all the Board of Health members have probably received the comments, the written comments thus far made by the public, and are familiar with the sentiments of the community along these lines. Additionally, we know that the federal mask requirement for transportation extends until at least March 18th, 2020. So this masking requirement will continue to be required on our buses and airports and the like. But we do know that gondolas are not included in this requirement as we move forward. Next slide, please. Testing. We've got some really exciting things around testing as well. We currently are going for Rsv Coded Testing community sites, one of which is in downtown Aston, one of which is at the ABC, and the other in Snowmass Village, are currently, as of this Monday, offer free same-day PCR test results for all ages. This is just something that we have not had up until Monday, this free ability of fast turnaround time, and we know that the PCR tests are the best way of detecting COVID at this point. They're the gold standard, and we are just so fortunate to have this tool in our community. We know that the cost of COVID testing is now covered by insurance, another recent update that makes availability of testing more within reach. And finally, at-home rapid antigen tests are available to be ordered for free, shipped in the mail and arrive in your mailbox. I know a lot of the schools and childcare providers have also received these tests to hand out to families to be able to have and keep at home. Next slide, please. School guidance. So CDPHE plans to release updated school guidance tomorrow, February 11th. That is going to be able to provide an option to transition to a routine disease control model for COVID-19. This moves us away from what we've been doing thus far in the pandemic, which is this individual case investigation response, and more to a disease control model, which we are familiar with for a lot of the other communicable disease that we address. We know that with high levels of vaccination in our community and our decreasing incidence, we will plan to move to this model, which strives to keep kids in school as much as possible. Under this model, isolation continues to be required. So if you test positive, you do have to isolate. Masks continue to be highly recommended, and they are required in certain circumstances. So like if you are going home to isolate for 5 days, if you want to come back after 5 days instead of isolating for 10, those last 5 days require a mask to be worn. But again, help us achieve our goal of keeping kids and teachers in school as much as possible. Outbreak prevention strategies in this model are recommended, so testing and masking following illnesses and exposures. And then the outbreak response strategies are really what we would use to respond if we see transmission in the school, if we see a higher rate of absenteeism due to COVID. That's when tools like cohorting, universal masking on a temporary basis, or some temporary universal testing are really those frontline responses. Quarantine continues to be an option if these strategies don't get things under control. But again, primary goal here is to be able to keep kids in school, keep schools operating in person, and use the tools that we have and know to work in this model. The next slide is the policy recommendation. As we have shared, the policy recommendation from staff is to rescind the current public health order that requires masking for those 2 and up. It also requires event safety plans for events with 50 or more people, and it requires businesses to communicate the traveler responsibility code to those visiting. The proposed date would be to do this after President's Day weekend, so February 22nd. As you Board of Health know, this was our initial staff recommendation. And after talking with a number of our partners, and especially our school partners, and listening to a lot of the feedback that we've been getting, we heard that schools would really benefit from a bit more time to transition to a mask optional model. So there's agreement that this is the direction that we are all moving in, but that to be able to do that large scale change management and to be able to bring everyone along, because I know we've got a wide range of opinions and thoughts and where people are at on this, and that the guidance, this would also be changing the guidance for them and how they address COVID. The staff recommendation is to then just have a mask requirement for children 2 and over in school and childcare settings through March 5th in order to give a little bit longer of an off-ramp for schools and to have that step-down approach. As I'll share in a couple slides, we know that there are a wide range of opinions as to where we go next with our policy. And so, as we move forward out of orders and requirements, the public health role is going to continue to be around education and recommendations. And as has been talked about, is really going to rely on individuals, organizations, and businesses to make decisions based on their own circumstances and risk tolerance. So, as the note says here at the bottom, businesses, organizations, and schools will always have the ability to adopt policies that are stricter than what is required by the county in terms of COVID mitigation strategies. This, I think Dr. Levin really talked to this. These can be stricter. We'll continue to have our 100% vaccination verified facilities program for those businesses being able to offer that level of protection. We'll continue to list them on the website and continue to encourage this as a great protective tool in the community. We'll also encourage, folks take higher risk settings or populations into account when setting policies at the organizational level. And public health, again, our role will be to provide guidance around this for the community. Additional mitigation strategies will continue to be recommended at the individual, for individuals at higher risk, and for those who spend time with those who are at higher risk. So just like Dr. Levin said, sometimes you don't know everyone's story or who they're going home to and who they spend a lot of time with. And so being considerate that this virus affects some of us very differently and is of a different level of risk for individuals. So while COVID's not over, the threshold for requirements is going to continue to be that we maintain our hospital capacity. So again, that's what we're having our eye towards, and would be, again, the threshold for needing to set some additional requirements in the community. With that, Greg, then you can turn it over to the partner updates.
I'll do that, Jordana. Thank you. I did want to say that this has been a tough decision and a tough policy, and I know you and staff have put a lot of effort and time into coming with this. I just wanted to reiterate we've had a wide variety of requests from the public and officials in various capacities who've asked for a much longer length of mask mandate, and others who've asked for it to be rescinded immediately. And I think what this decision has been, from my perspective, is that you're still going based on the data that you're taking in from our own data and from the state. And I think this is I'm going to say it's the best decision you can make based on the data you have. But I want to point out that we have a wide polarity from public opinion, from parents or teachers or school people. And we're trying to walk that fine line. And this decision, I think, is sound, and it's based on the best information we have. And I just want to reiterate that, because so much has gone into that one short line that you have on the screen there. With that, I will hand it over to Dave and Dave. I've got a question from Tori.
I do. Thank you so much, Greg. I'll break this into two parts. One is about the school mandates, and the other is the general lifting. I was just wondering if in the language going forward, not just the bottom note that says organizations have the ability to have more strict rules, and we encourage people to follow and adhere to those if businesses are asking those, or organizations. But are we contemplating any language that masks are still recommended? Or is the language just to rescind and not have a public health order going forward with that included?
So Tori, we would continue to issue that recommendation and guidance to the community, but it wouldn't be through a public health order. We've got some great communication channels with our newsletter and our website, and we'll continue, different kinds of, we get on Aston daily news, interviews at the top of the mountain. So there'll be other ways that we would be pushing that information out into the community, as opposed to public health order is really when we need to require something. That's the tool that we use.
Great. Thanks, Tori. If that's it, I'm going to turn it over to Dave and Dave, who are here. Welcome. Thank you for coming.
Thank
Great.
you.
Well, I guess this is Dave Ressler, and since I'm listed first, and David Bow, unless you disagree, I'll go first.
I happily defer to you, Dave.
Okay, thanks. So I would just like to first thank you for the opportunity to participate in the conversation. Doing so is very consistent with the spirit of cooperation that we've had during this entire pandemic as partners. And so that's really been very meaningful to us. Let me first say that I'll affirm what Jordana presented a little while ago, and that is that our overall status as the hospital is comfortable. We're in the green, as reflected on the website in our capacity matrix. We are still cautious, however, with regard to the number of employees that we have out ill. As of yesterday, we had 9 employees out. We have 500 employees total. So we're still just keeping an eye on that. There is still obviously virus in the community. And the good news, though, for us, and I appreciate very much Jordana's comment about how the hospital did, like all employers in the community, experience some very tough times over these past few weeks with Omicron. We did keep all of our services open and available. And I would say that a significant contributing factor to that has been our staff's adherence to the protection principles, but also the fact that we're 100% vaccinated as an organization. And so the symptoms that our infected employees did experience were generally mild to moderate. And that actually, I believe, is what you've heard today, reflects the larger community and our high vaccination rate as a community. So the very good news is we really, except for a period of time when we were experiencing a fair number of patients coming to our emergency department that actually pushed us up into the concerned category for that as well. During the Omicron surge, we never really experienced a surge in hospitalizations, and that's the goal. And so I just want to reiterate what Dr. Levin and Jordana have said, and that is that protecting hospital capacity is the North Star. And that is what has been accomplished in this community. And that is what I'm so appreciative for. And so on that note, let me just also say that I think that the partnership that we have here in Pickens County is our defining characteristic. The partnership between public health, healthcare, our physicians, our business community has really been a point of differentiation between us as a community and so many communities that I hear about through my peer network group of hospital CEOs that don't enjoy that level of cooperation and collaboration. So congratulations to all of you, to our community, our elected officials, our public health staff and our Board of Health and our chamber and our business community, because it really is remarkable how well everybody has worked together and communicated through some very difficult times and with some pretty tough conversations along the way. So yes, the bottom line is we are comfortable in our status and we support the decision or the recommendation that staff has made to the Board of Health today. We believe that we're at the place where we can support that decision. We're happy to be there, given our status, with the caveat that Dr. Levin offered that if the virus flares at some point and we start to see our capacity diminished, obviously that will be another conversation. But we're pleased to be where we are. And we thank you again for all of the work that you have done. And we're very proud to be part of this community. So with that, I'll end my comments unless there's any questions for me.
Thanks, Dave. I don't see questions. If you want to ask something, chime in. If I don't see you. David, Bob, why don't you pick it up from here? I just realized I've fallen behind on my agenda, but we'll pick it up. Thanks.
I'll try to move quickly, Greg. And thank you for the opportunity to join this meeting today. And note to the constructor of the agenda, we should have gone alphabetical because Dave Ressler is a really hard guy to follow at all times. So I want to be clear about that. I do want to thank the Board of Health and Pickens County Health Department for all the work that you've done. It's been quite a couple of years here in the county and in the country. I guess the last time I was here was in August, and I had the pleasure of joining this group for a discussion about putting on masks in schools. And we are truly grateful for your leadership in helping keeping our kids in schools and out of quarantines for the most part at that time. I do want to say it would be very presumptuous of me to speak for all schools and all the educators in Pickens County Health. So these thoughts are pretty much mine alone. I can tell you that, like the country at large, the response to going to mask optional falls on a continuum. Many are ready for the masks to come off. Many have no interest in the masks coming off. And most of us are somewhere in between with a little anxiety around going to mask optional. Throughout the pandemic, though, we have talked about following the science. But many are also done with the entire conversation about masking, about vaccinations, about the whole darn thing. And I can tell you that as your public school or even your private school teachers and administrators, we're really tired of being mask police. And it's hard work, especially when the kids aren't seeing masks being worn up and down the valley by the adults in this valley. Whatever is decided here today, I request that there not be a double standard for enforcement and guidance. I request that if we're not going to make adults wear masks, then please don't make students wear masks. And in that vein, if adults are not going to be quarantined, then let's try to avoid quarantining students. I can tell you that in August, we were extremely, extremely appreciative of the mask mandate put in place by this group. And as has been mentioned already, we're in a different place with a very deadly variant at that time. Since then, we've learned much about COVID-19 infection rates for children, the impact of vaccines on mitigation, and fortunately, how the Omicron is or is not hurting our community. And I can also tell you that the educational leaders in the county have been talking for quite a while. And I want to thank Jordana and her team for instigating many of the conversations and facilitating them and really listening to the educators in those rooms. I can tell you that our first desire is the welfare of our children and our staff. And I can tell you that we're looking to this group to make the right decision based on the science. And we've seen a lot of the science today, and that's super helpful. And I want to underscore that at this point, we know it's not just transmission anymore, but it's the health of the hospital and the severity of the actual disease. So as an educator, I also know my limits. And I want to paraphrase Mr. Stein of the Roaring Forks School District. And it's not my place to tell the fire marshal or the sheriff how we're going to respond to fires or criminal activity. In that vein, we're looking to the Health Commission to help mandate our next response or to guide the next response. It's really, we're educators. I can teach reading and writing and math, but I'm looking to this team for the next response at this level of the pandemic. I think we've been conservative in our approach to the pandemic in Pekin County. And to Dave's point, we've worked well together and across many different constituencies. We've avoided the polarization for the most part of other communities in Colorado and in the country. And I just would ask that whatever is decided today, that we remain not simply civil to one another, but actually kind and thoughtful and understanding of a person's decision to mask or to not mask. And I can assure you that from the school front, we will be striving to make sure that whether you choose to wear a mask or not wear a mask, that you're welcome and appreciated equally. And I want to send that message loud and clear. I would ask that we follow the science and would suggest again that if it is safe for adults to be mask optional, then it is also safe for children. Eagle County schools have led the way in this work, and Eagle County seems to be a good model that we can implement and move forward by following. We don't have to reinvent the wheel here. Finally, we have about 4 months of school left, and we look forward to a strong continued partnership to keep those 4 months healthy and safe and a great place to be a kid in all the schools in Pekin County. So with that, I want to thank you again for the opportunity to share Dave BoH's thoughts. And again, those are Dave's thoughts, not the thoughts of every teacher and every administrator in the county. But I do appreciate the opportunity to share those thoughts and appreciate all the work this group is doing. Thank you.
Thank you, Dave. I really appreciate that. There's a lot to chew on there, and it's great to have you weighing in. I'm going to keep things moving here. We're going to move on to Tori. Got a question from Tori? Go ahead.
I appreciate you, Greg. Thank you very much. I have a couple of questions for David from the school district, if you don't mind. And the reason being is because I speak for my city council. We are supportive of two things. One, rescinding the mask mandate, but we're also supportive of a measured approach to this. So understanding why we're taking the tack that we are. But the other thing that I've gotten from my council is that, it's very different. The school district and the operations at the school, as Dave BoH was just pointing out, as individual as maybe fire or sheriffs or police departments, the school district as well in its operations is very individual. So it's very hard for us to try to make general recommendations and rulings on behalf of the school district, because we recognize the intricacies that you deal with are things that we just can't really understand. So in that vein, I did want to ask you, David, have you gotten input? Is there a way to get input from your teachers? Is there a teacher association that gives you their input on an item like this?
We haven't formally, and that's a great question. We have not formally surveyed staff on this. I have spent the last couple of days talking to teachers across our schools, my 3 schools. Obviously, I'm not pushing into any of the other schools, but in speaking with our teachers, and again, it's not a professional survey. It's not completely randomized. It's not good science, but probably at a ratio of 8 to 10 of the teachers I spoke to, they're ready to take the masks off in most situations. There are, of course, some who have extenuating medical circumstances that Dr. Levin talked about, and we're prepared to address those on like an individual basis. For the most part, staff feel like, and I referenced the anxiety, but for the most part, we have a very high vaccination rate. We mandated it for one thing, so that helped. But then we're also providing access to KN95s. So between vaccines, the option to choose a mask if you want one and teach in it, which we know is not ideal, but you can do it in the mask optional environment. It's a pretty safe place to be a teacher in the school.
Thank you for that. Just a few more questions. These will be really quick. Have you been operating recently with, I guess I would call them mask breaks? Are classes being taken outside to take masks off? Is that part of the daily program these days?
So that's a good question. And that was part of the original mask protocols, and teachers can, if they so choose. We have found for the most part that 98% of the kids wear the masks and wear them pretty well when they choose to do so. I will tell you that the older kids are choosing to implement their own mask optional protocols a lot. So we're trying to, I referenced the mask police, but in the short, the accurate answer is that it's not a formalized process to go take mask breaks. We have found that they weren't really necessary.
Okay, and then the last question, I noticed from some of the statistics that were shared with us just a little bit ago, there seems to be a greater than 70% rate of vaccination for children 12 years old and up. And so I was wondering if there's been any conversation at the schools about perhaps different mandates going forward. And I just mean over this next stretch of about 4 weeks. But the high school or the middle school going unmasked on the 22nd, where those vaccination rates are higher, and keeping masks for younger grades as we make this transition. Has there been any conversation about treating the different schools and different vaccination areas differently?
Again, a good question. And the answer is yes, there has been conversation. We were waiting to see what the guidance, the final guidance or final decision is today before we make any policy around that. I will tell you that Jordana and her team have been very clear that they are here as a resource for us moving forward after today's decision. So we have discussed that. Our high school vaccination rate is hovering right around 80%. And then when you factor in the number of students who've had Omicron, well, we're well above 80% in the high school. So it would be very conceivable that we could do that. I think as the current recommendation is articulated, though, it says schools.
Yeah.
So
okay.
I don't know if we have the latitude to allow the high school to go to mask optional on February 22 as written. That would be a technical question for someone else.
All right. Thank you for those answers. I appreciate it. Thanks, Greg.
Thank you, Tori, and Dave, thanks for elaborating. That's an interesting question, and I'm sure it'll come back around. Okay, we're going to go into the summary of the written public comments we've received. And once again, very briefly, I just want to thank everyone who submitted comments to this. I know we've got an engaged community, and that's a good thing. And as was pointed out earlier, our public health measures in Pitkin County are exemplary, and the respectfulness and level of discourse has been quite high. And I think we can all be grateful for that. For the most part, people have been really good. I'm going to, I'll have more to say about the public comment when we start taking calls, but Jordana, if you're going to look at the summary of public comments, now's our chance. Thanks.
Yeah, we'll flip to those summary comments, and I just want to echo some of those thoughts as well, Greg. The community has been very thoughtful, has provided thoughtful, very well-researched comments. I'm really proud, again, to be a part of this community that encourages a forum for all of these opinions to be heard. And as we move through this process, want to encourage us as a community to recognize that we've got opinions that stretch across the spectrum, which we'll see here, and want to move forward in a way that respects and values all of these different points of view, while doing our best, as we've said, to make these data-driven decisions. So in the next slide, you'll see we received 216 total comments as of this morning when we were able to put this graph together. Some of the comments are counted in a couple of the categories, depending on what content they contained. The Board of Health has received all of these comments in full, but as a high-level summary, you see that one of the biggest comments here was a request to discontinue the mask requirements in schools and childcares at 44.4% of the comments, followed by the opposite opinion to continue the mask requirement in schools and childcares with about 11.9% of the responses. We had also a lot of comments around the county mask requirement, with 23.5% writing in to urge the opinion of discontinuing the county mask requirement, and 6.2% writing in support of continuing the county mask requirement. Over here, we had some other or mixed comments. Almost, let's see, 5.8% were asking the Board of Health to please just follow the science and the data. Saying that we really look to this board to make those decisions and take everything into consideration and respect that. There were some general comments about 1.2% to just have less restrictions and 0.4% asking for more restrictions. With that, Greg, I'll turn it back to you.
Okay, thank you. That was short and sweet. So that's a measure of the sentiment of the county in recent public comments through written comments to the Board of Health. Take that for, I guess I want to put a caveat in, and if there's an organized group really pushing to, add comments, that might skew the numbers, but, we'll take that for what it is. Okay, so now in the spirit of compassionate listening and with trying to keep a public forum open here, we're going to take some public comment now as promised. And I want to set the ground rules. As the moderator, the rules we do for public comment at the county are 3 minutes or less. I always like to say brevity is the soul of wit, which is a quote from Shakespeare. So if you can say it in less than 3 minutes, please do. If someone has already said what you plan to say, we're not doing a filibuster here. We're just trying to get through it. So I think a variety of comment would be great. Brevity, and then most importantly, I'd have to say respectfulness. This is a volunteer board, and it's a committee and a community that has put a lot of time and effort into trying to keep us all healthy and safe. And so respect for your fellow community members, regardless of their opinions, is really important. Um, if you go longer than 3 minutes, I'll remind you. But then also I'm going to ask you to be muted. If you can't stop, we're going to mute you and move on. And that's just so we can have respect once again for all the other people who'd like to comment. I'm probably going to shut this down probably at around 2:50 or 2:55 or something like that, if we have to go that long, because we still have a lot of discussion and decision making to be done. So I apologize in advance if you don't get a chance to speak today. You can still keep those letters coming, and there'll be chances for public comment in the future. I hope that works for everyone. And with that, I think we're going to get started. Now I'm going to need some help here. I'm not sure who's teed up, and I don't feel comfortable calling out names and numbers, but if I need to do that, Jordana, let me know.
We've got our staff who can give directions.
Okay.
Yeah, thanks, Greg. So as some of you have seen, we have enabled the raise hand function. So whether you're on your tablet or the computer, you should now see a raise hand option at the bottom. If you are someone who's calling in and would like to make a public comment, you can press *9 to raise your hand. And then when I do call on you, *6, you'll be able to mute and unmute yourself. And so how it worked, like Greg said, you'll have 3 minutes to speak. I will call the name of the people as they come up on my screen in the order that which they raise their hands. And you will see on the screen a time where it says 45 seconds remaining, and then when your time is up. So at that point, when the slide that says your time is up comes about, then you can wrap it up. But if you do continue to talk over your time for a significant amount of time, Chairman Greg will have to step in just to stop you. But if you have any questions, I will be here, and we'll get started with our first person, Jill Eddinger, and then Carson will be next after that. So Jill, I will allow you to speak, and you have 3 minutes.
Okay, go ahead.
Okay, am I unmuted? Can everyone
Yes.
hear me? Okay, great. I want to start by thanking everybody for your service. I recognize and do not minimize the difficulty and your responsibility, so thank you. I also want to reiterate my request in my letter to the editor of January 23rd, asking Mr. Postman to apologize for his comment, basically saying that matters of COVID policy were quote unquote not the sort of thing that you have a public process or debate over. I'm not trying to single out Mr. Postman. I appreciate his service, but this comment was deeply offensive and improper coming from an elected official in a Democratic government. And today's attendance at this meeting is a demonstration of, in fact, an organization in reaction to the troubling nature of that comment. Why? Well, this is democracy and this is government by the people. But what I want to focus on is because the choice of how a public body such as yours proceeds in policy choices like the ones before it today may be less important than whether or not the people support or follow it. This is a fundamental principle of democratic governance that, if overlooked in decision-making, will prove to have serious consequences. To have an effective response to this pandemic, the public must have trust in the leadership and a shared sense of the danger. But these are deteriorating at alarming rates in our community and nationwide. This division will make it harder for leaders to lead out of this pandemic and this crisis. Put differently, you need buy-in from the people, but that buy-in is waning big time. And you see this with the people here today and the comments you've received that clearly show opposition to the masks and the overreach policies. What the people are saying is there are other interests at stake that we care about immensely, like education, mental health, and our kids' interests that go beyond their health from COVID. I want to address, since I only have a minute or so, the virtue signaling that has gone on nationwide and in our community. This idea that those who favor the position to take off the masks somehow care less about our community and our kids. This is not true. We have different views on how to balance these policy goals, but I would just ask everyone to be mindful that there's only so much that you can ask of people to put their needs, the needs of others above their own children and their families. That's not selfish. That's called being human. and people have limits, and you can see that people are signaling to you from a mental health standpoint, they can't do this anymore. So reserve these draconian policies for when you need them, but release these unnecessary mandates now that aren't necessary. And that conclusion is supported by the science. Please give the choice back to people. By all means, if you are a parent who wants your child in a mask, I have no problem with that. I respect that, but give the choice back to the people. Thank you.
Thanks, Jill. Your time's up. Thank you.
Thank you.
Thank
Okay,
you.
who's
And
next?
Carson, you will be next up to speak, and then Elizabeth Stewart, you will be after Carson. Carson, go ahead.
Thank you. Can you hear me?
Yes.
Hello? Okay, great. I will be less than 3 minutes. So I just wanted to, thank you all. I appreciate your service. I know what it's like to serve in a public position that is maybe not appreciated. I guess what I would just point to is the public health equity statement, and not just in regard to the decision today, but for future decisions as well. And so the Board of Health public equity statement says, we believe in the catalyzing power of equity to engage and enrich our communities, as well as identify challenges and design solutions together. I do not see how it's equitable to mask a 3-year-old that's trying to learn how to put their socks on, or a 5-year-old with speech problems. At the same time, you're letting the champagne dance party at Cloud9 rage. I mean, dancing on a table, singing and spraying champagne everywhere is not more important than kids that are learning how to talk, learning how to socialize, learning how to read facial expressions. So requiring kids to be masked when adults are not it's out of step with your equity statement. And I would just ask you to consider that as you make a decision today. Thank you all again for your time. I genuinely appreciate all you're doing, the difficulty of the decisions, and the understanding that regardless of what you do, not everyone is going to get their way. So thank you.
Thank you, Carson. Okay, who's next?
Elizabeth Stewart, you're next, and then Anna Mari, you're up next after. Go ahead, Elizabeth.
Hi, everybody. I just want to thank you so much for all the time and effort that all of you have put into this. I just want to briefly state that, my name is Elizabeth Stewart, and I do live in Pitkin County, and I love this area and community. It's where I spend my money and my time, and I would really strongly appreciate the mask mandates to be removed, but most especially in the schools. Like people have said before me, our students and our kids are really struggling. I personally have a 4.5-year-old, a 2-year-old, and a 1-year-old. And it is really, really challenging to tell my kids that we can't go do activities because they can't keep their masks on. Especially my 2-year-old son, he is so just passionate about people, and he just so enjoys being in our community, and it has been so hard for him. I would just love it if you guys can get behind our kids and remove those mandates. And like I said, just especially in schools. Obviously, I know there's a lot of emotion and just a lot that comes behind this, but I pray that you would just look at that graph again and see where those families are, where the communities, where the comments are. We really are just focused in on our students. That's all I have to say. Thank you guys so much.
Thank you, Elizabeth.
Next up is Anna Marty, and then Nick is up after that. Go ahead, Anna.
Hi, thank you so much for this opportunity to speak for the children. This is why we're here, and it was so sweet to hear that little baby speaking in the background. It really just warmed my heart and made me realize why I'm on these meetings. It's for the children and for their mental health. I've had enough people tell me about their child committing suicide in high school or in grade school over the last year or two, and I'm done with watching these children suffer and somewhat, I'm going to be a little bit straight up with this, be tortured. When I'm at, X Games and Gay Ski Week at the Apri parties, and there's hundreds of people and the Caribou Club, for Halloween, there's like hundreds of people shoved in this little postage stamp of a space with no mask. And these poor children, can't even see their friends' faces, and they're being schooled by their teachers who I was a teacher at one point to be made to be the warden and like the police to put these masks on these little 2-year-olds and 3-year-olds who don't understand why this is happening, and they don't spread it. They are the least. I think if you take comorbidities away, they did a study in the UK. I think there were 0 children that died of COVID over the entire pandemic under the age of 11 or 12. 0. Take the comorbidities away of like asthma, not even asthma, like cancer. And it's insane. So I'm just going to put a couple facts out here. First of all, the WHO said in the beginning that masks provide no medical benefit whatsoever. It's on their website. There's tons of screenshots of it, but they may provide a potential emotional or psychological benefit to make people feel a little less scared and maybe a little more safe. Well, sorry, but I don't need to feel a little safer making children be tortured, but wearing a mask so I can maybe feel a little safer so I can go eat my Cheetos and drink my beer. You know, I should take care of my own immune system and let these children have their freedoms back. So that's the WHO. Secondly, China did a meta study. There were millions of people. This study is insane and no one ever looks at it. 10 million people showed that asymptomatic spread of COVID never existed. This is China, who is completely contact traced, locked down. You know, they locked these people up. They could see where they were. Like, it's the most perfect case of a study. And 10 million residents, they did this. And of all the close contacts and all of the quarantining, nobody got COVID from an asymptomatic spreader. Not one, not like 10%, 5%, 1%, 0. So there's another case. The other one, Israel just cancels their COVID state of emergency. UK Prime Minister Boris Johnson drops COVID restrictions completely for the entire country. Democratic governor in Nevada just dropped a mask mandate for all their students and their staff. Democratic. So, hey, hello, here we go. One of the last governors in the nation to drop their indoor mask mandates. Okay. And if you look at the foremost expert for occupational hygiene, which is what you go to when there's like, you know, poisonous things in buildings, a foremost expert on this is called Stephen Petty, and he said, bar none, masks do nothing. So there are hundreds of people out there, doctors to experts in the field where they're the foremost expert in the entire world, where they're hired for these things, are saying they don't do anything. So I want to thank you so much for the time, and I want to thank you for your consideration, and let's drop it for these kids and give them their freedom back. Thank you.
Thanks, Anna.
You're welcome, Greg. Thank you.
Okay, next.
Nick, you're up next, and then Yolanda Melendez will be after you, Nick. Nick, go ahead.
Can you hear me now? Hello.
You're on. Go ahead.
Thanks for all the hard work. You know, science is the intellectual and practical activity encompassing the systematic study of structure and behavior of the physical and natural world through observation and experiment. I've been highlighting these observations to the Board of Health since August 2021. Per CDC data as of December 2021, the number of deaths in children under the age of 15 is approximately 2 deaths per million. The mortality rate in adults greater than 85 is 85%. Adults over 75 account for 50% of COVID deaths. The CDC has overestimated mortality rates in kids from the beginning. Dr. Marty McRae, professor at Johns Hopkins, concluded that 100% of COVID deaths in children occurred in children with pre-existing conditions. From January 2020 to August 2021, there were 361 COVID deaths in children less than 18. This is lower than 50% of the last 10 flu seasons and much lower than the April 2019 swine flu outbreak. I've highlighted these observations as they demonstrate there's a very low risk of death in children. When I emailed the Board of Health in August 2021 inquiring why mask this low risk demographic when there are clear and social emotional issues as well as learning obstacles, I was sent 7 studies in support of the Board of Health's decision. I read these anecdotal observations and wrote to the Board of Health that none were conclusive in supporting their hypothesis that wearing a mask prevents the spread of COVID. The efficacy ranged from 25 to 79%. In fact, the most relevant study conducted in the elementary schools of Georgia indicated a 0.762% infection rate when masks were optional versus a 0.488% infection rate when masks are required. We now know there is zero efficacy in vaccines' ability to prevent infection. All teachers at my daughter's school are vaccinated, boosted, and wear N95 masks. The children wear N95 masks and or double masks. Pickens County's data shows that 75% of the student body is fully vaccinated. 80% of our population is vaccinated. Yet, despite a high vaccination rate and mask mandate, we have relatively high positivity rates in our community. The WHO does not routinely recommend masks because of the quote unquote potential impact of wearing a mask or learning and psychosocial development. The American Academy of Pediatrics has declared mental health emergency in children, as the Surgeon General recently highlighted. Combined analysis of 80,000 children found that symptoms of depression and anxiety have doubled among young people during the pandemic, with 1 in 4 showing depressive symptoms and 1 in 5 showing anxiety. Personally, I feel we are teaching our children to ignore their feelings and not question authority figures. If in the future an authority figure inappropriately harasses our children, will we have the ability to come forward, or will their current indoctrination cause them to acquiesce? I ask that you respectfully ask that you remove the mandate for kids. Thank you.
Thank you, Nick. Okay, who's next?
Thanks, Nick. Yolanda Melendez is next, and then after her, Catherine Lutz. Yolanda, go ahead.
Hi, my name is Yolanda Melendez, and I have an 11-year-old little girl. And I just wanted to tell a quick story. This weekend, she spent the night at her friend's house, and they obviously, were in close contact. And when they walked home, back to my house together to come here and play, the little girl, not my child, but the other little girl, wore a mask outside to get from her house to my house. And I thought that was curious. And I see children get off the buses they're outdoors and they're wearing their mask. And I feel like these girls and kids maybe be hiding behind their mask. That may be what it's partly doing, is helping them hide. And I feel like, as far as resources go, perhaps the mental health, of these children would be a better place to allocate resources, as opposed to trying to control this virus that is minimal. My child and I both had it, but for the most part, for the kids, it's low risk. And I feel like the risk of little girls struggle with their self-confidence as it is. And, I just think there's better ways to spend the money or the resources and maybe start getting some other things addressed, as far as, well, I don't know. I don't believe in a whole lot of government in any way, shape, or form. I don't know that they should be delving into other problems that the children's may be having either. But I don't feel we should be adding to it by allowing these kids to hide behind the mask. I don't think that's healthy, and I think it's oppressive. So that's all I needed to say. Thank you for letting me share. I appreciate it.
Thank you, Yolanda.
Next person is Catherine Lutz, and then after will be Jennifer Hall. Catherine, go ahead.
Hi, thanks for taking my comment. I fully intended to submit a written comment, but some personal matters got in the way. So thanks for taking comment at this meeting. And my comment will be slightly different from those that went before me. And I believe, somewhat more somewhat supported in the community as well. One, I understand that universal masking in the schools has been basically the main thing that's prevented the quarantines that we've had of last school year. So I want to, I fully support that. I had children who endured endless quarantines last year, and I say that staying home from school, trying to learn remotely, is far more dangerous to their mental health and ability to learn than wearing a mask in school. And I do have slightly older children, an 8-year-old and 11-year-old. So I would say keep masks in schools in order to keep kids in school. If you're going to do away with the mask mandate for schools, then please do away with quarantines as well. Because at least for vaccinated children, I know that in the broader community, if you are vaccinated, you don't have to quarantine when coming into close contact with a positive case. So I think that should be the same in schools. If we go back to a situation where there's endless quarantines, it's just going to be bad for the second half of the school year. So please, if you're going to do away with masks, also do away with the quarantine situation. And yeah, please consider that keeping masks on kids in the schools also keeps them in school. Now, I also sympathize with parents of children of younger ages, and I would say kind of the opposite. I'm no expert in the field, but I would say that if you're going to do away with masks and break it up by a certain age group, it's probably the younger kids that need to take the masks off before the older kids do, because of their lower level of risk, because of they're still learning the language, that sort of thing. As far as the recommended timeline for keeping masks in schools until early March, I would ask, is that really enough time? Please consider that President's Day weekend is coming up, spring break is coming up. We're going to be able to start opening our windows and letting the air in, sometime in March or April. So also, if there's going to be some kind of time frame associated with this, maybe it's after the winter high season has passed, after spring break has passed. Consider that as cases rise in the community, they will also rise in the schools. So yeah, that's my comment. Thank you.
Thank you, Catherine. Who's next?
Jennifer Hall, you're next, and then Paul's son, you're after Jennifer. Jennifer, go ahead.
Oh, hi, can everybody hear me?
Yes.
Okay, great. I know some of you, I'm an attorney, and I know that you can always find an expert to support any position. And I will agree that what our schools are saying, what the hospital are saying, is that there are people at all angles on this, everywhere on the spectrum. And I'm one of those people who do not believe that masks are effective. And I'm looking at my short list of 47 studies in front of me that say that. There may be some psychological benefit to them, but as far as preventing the spread of disease, they're not effective. And I also don't think that they're necessary in schools. I'm looking at the Stanford study recently done that shows that 99.9987% of cases in under 20 years of age did not result in death. So that's a 0.0013 death rate, or 99.987 survivability. These kids are not transmitting it, and they're not dying from it. And it's just not necessary to put them in a mask that doesn't work. But the most important part is that this is killing our children. 364% increase in speech problems, reductions in IQs, and then physical problems like headaches, hypoxia, rashes, faintness, kids passing out in schools. And I personally have experience with my child having physical problems with the mask. I don't agree on keeping a failed public health policy in place by continuing to mask just because it allows you to keep the quarantines down. So I think, when it's a public health policy, that's failed, just rethink the whole thing and do what's right. And not to be snarky, but really, I remember saying to somebody at one point in time, why can't we just bring restaurant tables into the schools then, or have the kids eating all the time and everything's going to be fine? To agree with the other person who made the comment that these kids are not stupid. They're walking around and they're watching us as an adult, be completely normal with the mask off, and they're passing out in their classes in school. They've got horrible rashes and acne, and they're not they're not learning. So I just think, well, let's come up with a way. And I think the thing is to drop the mandates. Let's let these kids learn. Let's let them get back to normal. And I think that what we've done has been unnecessary. It's failed, and we're not at a high pressure point anymore. And it's time to let these masks drop. And I want to support everybody that thinks that they want work and they want to keep wearing the mask. Please do. I don't want you to live in fear. And I hope that that brings you comfort, but let the rest of us, particularly our kids, move on.
Thanks,
Thank you.
Jennifer.
Thank you.
Next up is Paul's son, and then after Paul will be Felicia Aldrich. Paul, go ahead.
Hi there. I'm part of the 4-to-1 group that wrote against mask mandates in schools. There's different opinions on different subjects here, but I guess I would echo what Dave Boss said. If this board hears only one comment, it was his comment that there be no double standard. We know for sure that the kids are least at risk of this pandemic. There's no question about that. We also know for sure that masks are least effective on kids. So to take the masks off the adults and not the kids is the least data-driven decision you can make. So you can stand there and say, we are data-driven, but if you make that decision, the credibility of this board will be shot. There is no justification to have masks on these kids. Take them off along with the adults at the same time, and that's it. That's my comment. Thank you.
Thanks, Paul.
Next is Felicia Aldrich, and then after Felicia is Jordan Duchin. I apologize if I mispronounce your name. Felicia, go ahead. Let's see. Sorry, Felicia. It looks like I just got a pop-up saying that you're using an older version of Zoom. I will just promote you to a panelist so you can speak, and then I will promote you back to a attendee. So you should be able to speak now, I believe.
Alicia, we can't currently hear you. If you're on a phone, you can hit *6 or unmute potentially.
Can we put her in the queue and maybe she can call back? I'd like to keep moving.
Yeah, absolutely. Next is Jordan, and then after is Carrie Down. Jordan, go ahead.
Okay, we're not hearing Jordan either. Sorry, folks, I think we want to keep moving. If you're not there, try again, getting back in the queue and we'll look for you. But who's next?
Next, Carrie Down, and after Anna Zane. Carrie, go ahead.
Hi, everyone. Can you hear me?
Yes.
Hi, thank you so much for this opportunity to speak for a minute or so about this very important issue. My name is Carrie Down. I'm a mother of 3 in Pitkin County schools. I'm in 2 different schools, actually. And I'm here to ask for the mask mandate for children in our schools to be a choice. I'm not asking for those parents that need it, that feel great about it, that know in their hearts that the kids feel that the kids might be safer to not put them on. I respect that 100%. Let the parents like me who believe that it's actually doing more harm to take them off. I can't tolerate that our children are, quote, resilient anymore, that they're not. They're not okay with wearing masks. They don't like them, and they're not getting used to them. Honestly, they're wearing them because authority figures like our teachers, our government, our parents, people around them are telling them to wear them. I think that these children are built and hardwired for connection, and they're losing this at school. They really are, you guys. They are losing the connection at school. They aren't reading emotions properly. They feel fearful because if the mask is on, oh, they're a little safer from getting sick. It's time that we give the choice to the parents. We are at a completely different place than we were in 2020. I am the first to admit I was the mom who was terrified of COVID. You name something to do to keep my family from getting COVID, and I did it. I did it every time. But with more science, with more data, we know where we're at. We know the kids are the ones that are the least risk right now, and they are the ones that are suffering the most. I had the very great honor to substitute in the last couple months for some of the schools in our valley. I'm a mom, but I have been a teacher in the past, and I went to school and I put my mask on at 7:45 and I took it off at 3 with an exception of a lunch break. I can tell you that there are teachers out there that must feel this way too. As a teacher, I couldn't connect. My voice was hoarse. I felt weak at the end of the day. The children, I watched them. They were not connecting as they should. They were not looking at each other and reading cues and smiling at each other. I have a preschooler, I have a 4th grader, and I have a 7th grader. 4th grader and a 1st grader. So I have different ages. I will say the preschool kids, I have a great friend. Her kid is speech delayed in the last 2 years because of this. He is not reading the right cues. I just ask that we all come together with the respect from mom to mom, father to father, school to parent, and let us have a choice, because I think that with someone else who needs to wear a mask, I think that's great. I respect it. I think that if a teacher wants to wear an N95 because that makes them feel safe, I commend that. Just let us parents choose every morning when we put our kid on a bus or we drop them off, if the mask in the school should be worn for that day. That's all I ask. Thank you guys so much for your time and everything everyone's doing here. I appreciate your time.
Thanks,
Bye.
Carrie. Okay.
Next up is Anna Zane, and then after Alyssa Schmitz. Anna, go ahead.
Great. Can you guys hear me?
Yes, we can, Anna.
Thanks so much. And I'll just say to any of those people that are waiting that we didn't know how to unmute, it pops up on your screen to unmute when you're called on. So if anybody's curious, thank you all for letting me speak today. I really appreciate it. I'm going to call on the Board of Health to not approve the recommendation that was just put forth to extend the masking in schools until March 5th. I just really don't think it's fair to our kids anymore at this point. My daughter just sent me a text about an after school thing, and I said, it looks like they're going to make you keep the masks on another month. And she said, why? What difference does a month make at this point? The kids are going to see that up and down the entire valley, that the kids are going to be able to take masks off of schools when CDPHE puts their rules out tomorrow, and that they're going to still be stuck in masks up here. They really are having a hard time. I can tell you that. I know that the kids are. My 4-year-old started speech therapy yesterday. There's just a lot going on for these kids. And the other thing that I just want to finish with real quick that I put in my written comment, there was an article in the Washington Post a few weeks ago, and in it they were talking about one-way masking and how it works. And in a school, they did a dry run of going mask optional. And the quote that I love that they said in there is what they found after their dry run of optional masking was that smiling was more contagious than COVID. So I just really like to ask you guys to not approve the health mandate, to treat the kids the same as you treat the adults. They know what's going on and they will appreciate it more than you know. So thank you so much.
Thank you, Anna.
Next up is Alyssa Schmitz, and then after will be Julia Russo. Alyssa, go ahead.
Hi, so this is Alyssa. I live in Pickens County in Snowmass Village. I have 3 kids, a 4-year-old, a 3-year-old, and a 1-year-old. And thank you all so much for allowing us to submit public comments, say public comments, and participate in this big decision you have to make. I do not envy any of you at all, and I really appreciate the time and the effort that you are putting into, do this for our community. So just a few points. I am totally pro mask choice. If parents want to have their children still wear masks, or if they still want to wear masks, that's totally fine. I understand everybody has their own opinions, obviously, and their own situations. Like somebody said earlier, we don't know. Like when you see somebody wearing a mask, yes, they could have cancer. They could be living with somebody with cancer. I mean, I totally am respectful of that. But in the same sense, also respect people who choose not to wear them. Maybe they just had COVID and they are fully recovered. They don't have to worry about giving it to somebody else or getting it again. So let them be mask free if, you know, they feel comfortable because they just recovered from it. Or, you know, maybe their child has a speech problem or a hearing problem and they lip read, or, you know, they aren't the best at listening unless they can use multisensory, you know, inputs by visualizing and looking at people's mouths moving. Same for reading emotions. I know, you know, body language and facial expressions can do so much. And some people need to see that on people's faces to really pick up on emotional cues. So I think the respect goes both ways in that sense. Like just let people decide what they want to do for themselves. I think the thing for me, and I don't want to cry, but I see it in my 4-year-old, he's fearful about getting other people sick. And I think that's really hard because he doesn't understand all of the facets that, you know, go on with wearing a mask. Like he literally thinks if he does not wear a mask, he could get someone sick, which, you know, I don't know if that's true or if that's not true, but I don't want him to be afraid. I want him to know and enjoy life how it used to be before all of this, and not feel like he needs to have that mask on. I just want him to experience things normally, as I think a lot of us do. So thank you for trying to get us back to normal as soon as you possibly can, especially our youngest kids. I also agreed with somebody else who said, let the preschoolers take them off first. It's so hard for them to wear them consistently. My 2-year-old or my 3-year-old can barely put his on and take it off on his own. And he doesn't even know if it's not covering his nose or not. So unless a teacher is helping him pull it back up, it's not consistent. And they nap and they take it off at lunch. The second they take it off at lunch, if there's those particles in the air, they're getting sick. So I think when there's so little like that, it's just, you have to look at the consistency. And if the consistency doesn't make a difference for their quarantine times, the vaccine's coming, you know, if people want to do that, they're going to have that as an option really, really soon. But let's just get them on a mask. Thank you. Sorry. Okay.
Thank you for your comments.
Of course. Okay. Bye.
And next up is Julia Russo, and then after will be Jeff Flack. Julia, go ahead.
Hello, can you hear me?
Yes.
Hi, everyone. I want to thank everyone that's participating in the meeting, but most of all the parents that are standing up and trying to get the mask off the kids. I don't care if you want to keep masks on adults forever. I hope not, obviously, but we are hurting our kids. I saw on that chart that you guys showed that almost 50% of the people that spoke since you guys opened the public comment, looks like almost 50% of people in this valley want to take masks off kids in school and daycare. And I'm really happy to see that. And I love hearing parents passionate about it and talking about it. And unfortunately, this is the bad part. But hearing the stories and how many kids are doing speech therapy and, you know, are afraid or terrified of getting sick or getting other people sick, or completely freaking out about getting sick. Getting sick is normal. That's how they build their immune system. I remember in the yellow brick building, how vibrant that building was in the past, with parents walking around the corridors, kids running around, meeting from different daycare schools there. And now that the building is just sad. You just drop your kid out the door and you run away. You don't have time to talk to anybody. The kids cannot even, you know, you don't even know who are the kids that are in the class with your own child. That's really sad. You don't get to mingle with other parents, you know, in a naturally, you know, drop off, pick up basis anymore. And that's really sad. I was the one that back in August, when you guys voted to mask the kids again, I wrote a petition. I'm from Brazil. I'm not a wealthy Aspenite. I do not, you know, have much influence here. I was even told that someone was like, oh, who wrote this? Oh, no, I thought it was somebody else anyway. I'm just, somebody that moved here, and I love this valley. I love this place. I want to be here forever if I can. But right now I spend 6 hours of my week driving my son down valley so he doesn't need to wear a mask. He does not wear a mask. Since you guys voted this in, I chose to pull him off the daycare that he loved, and I drive him to another place that he loves it. He loves it now, but at the time I didn't know. And he doesn't wear a mask at all, ever, thank God. And he's doing great. I think kids should never be obligated to wear a mask anywhere in this town. You can sit down and take a mask off. Why not the kids? Let them sit down in their desk at school and take their mask. And this should be done as soon as possible. Tomorrow, this is like hurting them. Give the parents the choice of taking care of your own child should be the parents' choice. And I think this should be done as soon as possible, especially for the young kids, but for any kids. Thank you.
Thank you, Julia. We're going to start running out of time here, so I'm going to take 2 or 3 more comments, and then we're going to change course. And I know there are more people online, and I apologize to them in advance. You can always submit a written comment, and you can always speak up again at the next public comment. So I apologize, but we are going to cut it off in a couple more, I'm going to say 3 more speakers. Thank you.
So the next speakers are Jeff Flack, Kristen Strope, and then Tamara. Jeff, go ahead.
Hi, I'm actually Jeff Flack's wife. My name is Summer Flack, and I am a nurse and have been a ski patroller in Aspen for 15 years. I am a mother of 2 young boys, a 1-year-old and a 3-year-old. And I have watched my son come home from school with a mask completely covered in mud and filth and fearful about viruses. My mother is also a speech therapist of 30 plus years, and she has seen changes after the children have been masked as well. I believe that the masks are detrimental to mental and physical health. I believe and support freedom of choice. I support an individual's right to choose what makes themselves and their own family safe. I respectfully request to repeal the mask mandate and allow individuals to make a decision what's right and safe for their own family and children. Thank you.
Thank you, Summer. Okay, next.
Next up is Kristen Strope. Kristen, go ahead.
Hi, good afternoon. Thank you very much for hearing all of us. My name is Kristen Strope, and I thank you for your time today. I live in Carbondale. I have a 6-year-old son. Sorry, I'm just being asked to give up my spot. If that's okay, I can pass.
Sorry, Kristen, who's asking you?
It's okay. It's okay. I'm
Okay,
happy to.
I'm wondering who's managing this from the other end. Sorry.
Oh, I'm just at work, and so they need me because I've been on, so I need to get off.
Okay, so thank you, and we'll take the next one.
Tamara, you are next. Go ahead.
Great.
Hi, my name is Tamara. Thank you for hearing all of us. Greatly appreciated. I have a 3-year-old daughter. She has a speech delay. She's scared. Sorry, very emotional. She's missed more than half of school because of the fighting and the crying over putting on her mask. I don't really have anything much to say, but the little ones are suffering, and because she suffers, so do I. I would gladly wear a mask. Take it off my child. Thank you.
Thanks, Tamara. Okay, do we have another one? These are going faster now, so I'm going to take, I'll take a couple more, but we're going to end it soon. Thanks.
Okay, next, Andrea Bryan. Andrea, go ahead.
Hi, can everybody hear me? Thank you so much. And I want to echo the thanks and the gratitude to all of you. You are making an incredibly important decision today. And I know it's not an easy one. But based on the data and the science that was cited today, I don't think there should be any dispute that it should be evident that schools can safely allow masks to come off, mask choice, without jeopardizing in-person learning. Parents, as you've heard and as you've read in the comments, are recognizing this. My review of every single public comment was that there were 148 for masking choice and 47 for keeping the mandates in place. One of the most compelling letters I read was from a mother of an immunocompromised kid who begged you to take the mask off of her immunocompromised child because it was resulting in further stress and further learning impairment and stigmatizing. So please consider that. Consider that other states are lifting restrictions, other countries are lifting restrictions, our neighboring counties are lifting restrictions. The World Health Organization, as it's been said, doesn't recommend masking children under age 6, and many European countries have never masked kids under age 12. Our incidence rate is in sharp decline. So if not now, I ask you, when? The kids need to be the very first to unmask. COVID zero is not attainable. We're not going to live in a world free of risks. We're not going to live in a world free of infectious disease. There may be a new variant one day. It's possible that the restrictions might need to be ramped up again, but we can't be making important public health decisions based on these speculations and feelings and fear. The best analogy I heard was comparing this to the weather. That was in a recent article I read. When it's raining, you put on a raincoat. When it's sunny, you take it off. Our children have been wearing their proverbial raincoats for 2 straight years at school. It's not logical, and it's having significant mental health, behavioral, and social effects on children, not to mention the way it interferes with their learning. Another quote I heard was that, if anything, I think we can all see and feel that mask wearing for our children is reducing their quality of life and leading to a general sense of malaise. These are our children. In Pitkin County, when you look at the data and science and the current trends, things are looking sunny. Take off those raincoats, take off the masks, give our children some normalcy back while we can. Let's shake off this pandemic malaise. And to be clear, I am not anti-mask. Those who wish to continue masking if they feel safer with what the CDC says are highly effective one-way KN95 masks on their children, they can mask their children. That should be their choice. And then my final comment here is that if more and more people think that the Board of Health is out of step with the science and the actual risks, they will be less likely to trust public health officials in the future. You can signal to the community that you're not in favor of indefinite masking of our children. You can adapt as circumstances do, and the public should feel confident in following your advice and public health orders. It's time to end this pandemic purgatory.
Thanks, Andrea. Okay, I think that's going to bring our call to a close. Did you have somebody else you promised to bring on? Sorry, but I think I'd like to end it here unless you made a promise to another person. I can't remember. Was there another name on the list?
No, that was it, Greg.
Okay, then we're going to move on. I want to thank everybody who's made a comment today. I appreciate the time they took and the organization that made it happen. So thank you all for taking the time to weigh in. Moving right along, we are at board discussion and decision. It says I'm the one running this part of it. Okay, I guess I'm going to open the floor to our board, and if we have any questions or comments, we've heard a variety of points of view here today. We've heard a lot of strong opinion, and I'm willing to open the floor now. And if I can't see you, it's quite possible. I'd love to hear you chime in.
Jeannie's got a hand up.
Jeannie, thank you.
Hi, thank you for the community for all of the thoughtful comments. I support the staff recommendation of dropping the public health orders. I believe it's time. Pitkin is one of 5 counties in Colorado that still has public health orders, and we are so highly vaccinated. Plus, many people have had it, and our hospital is very comfortable. We haven't had many admissions lately. And Eagle County did drop its mask recommendations for its schools in January, and they're doing fine. So I support dropping all masks in school. I just have a question about why we have to wait until March 5th, since I guess we would have to, it gives the schools less flexibility in terms of being able to unmask high schoolers. And we also know that for the under 5 group that can't be vaccinated, that RSV and influenza is far more dangerous in terms of risk of hospitalizations. And yet we don't mask or quarantine for those diseases. So can we just drop it all on February 22nd?
Thank you, Jeannie. I see Krista has her hand up.
Thanks. Yeah, can you all hear me okay? I just want to pretty much fully support everything that Jeannie had, and really thank you to everybody that's been doing this. This has been a really challenging time, and it's going to be challenging to come out of this too. I think that we need to realize that there's a lot of fear around this still on both sides, and that it's going to take people some time to adapt to new standards. I do think it's a time of celebration. We're talking about a virus, and we're asking you all to think about a virus we haven't been talking about here. Omicron's been something different. It hasn't killed as many people. It hasn't even hospitalized as many people. So many more people that have gotten it than we even are aware of. And luckily, they did not get very sick, our children included. And I think that that's what this really is. We are here today because 80% of us plus probably have immunity in our state. That's what we wanted to achieve through vaccination, so we could get rid of these mandates. So here we are. Our kids are included in this. I think that, again, looking at the science and why we decided to put masks in school back in August had a big part to do with those quarantines. We wanted to keep kids in school for as long as possible. And we knew that if both parties were masked at that time, they would not have to go home to quarantine if somebody was exposed. We've talked about this in previous meetings. This prevented thousands of quarantines this fall. But that's not going to be the case anymore after CDPHE changes their guidance tomorrow. So we no longer have to wear masks in school. The other reason we were wearing masks in school does not have anything to do with kids never getting it, because we as a country decided long ago that COVID was going to spread. We wanted to spread it more slowly. And that's what the masks in school were for. They were to slow down spread, to help our hospital capacity. Again, celebration, we did it. Our hospitals in Denver, our hospitals across the state have less than 1,000 patients right now, which is the least we've had in a really long time. So I think we need to celebrate as a community, and I'm hoping we can all remove our masks at the same time.
Krista, thank you for your comment. The floor is open. I'm looking for, I see Dr. Kurt.
Can you hear me? Well,
yes.
I would like to commend and thank Jordana and staff, as well as Dave Ressler, Dave Baugh, for their input, because reviewing this takes a great deal of strength and willpower to overcome the problems related to COVID, especially with the Omicron variant that is now in lull. I support both Jeannie and Krista, as they have said. We're supporting the staff, and we are also asking, why cannot the school also have the masks removed on February 22nd, or have the option of doing it on February 22nd? In addition, I would like to point out that we need to be vigilant for the Omicron variants that are coming up potentially, the BA.2, the BA.3, and hopefully they will be less of a problem. And I also wanted to add Josh Vance for his superb epidemiologic help. So I support the staff's recommendation. I thank profoundly all the people involved. And this is a time for celebration as well as vigilance for the future.
Thank you, Dr. Kurt. I just wanted to make sure I understood it, because I thought I heard you say you support the recommendation which took the school masking to March 5th. But then I think you also said that you thought maybe it's time to have the option of unmasking on the 22nd. Can you just confirm your point of view on that?
Yes, I support Jeannie and Krista on having the school masking, unmasking on February 22nd instead of waiting until March the 5th.
Thank you for the clarification. Okay. Looking through my list at other board members, I see Patty Clapper.
Yes, yeah, I'm gonna make comment. First of all, I'd like to thank all the parents and concerned citizens that called in for public comment. I know it's not always easy to stand up for what you believe in, but that's what we love about this country, and we appreciate them taking their time. Greg, you did a great job running that. Yeah, I'm supportive. I'm not a voting member of this board, but having paid a lot of attention to it, I myself feel that masks do make a difference. And I will be wearing mine when I'm in circumstances that I'm uncomfortable with, which I applaud the rest of the community for feeling comfortable when they choose to wear masks. I would be supportive of ending the masks for both the schools and the general public at the same time. I think for continuity, and we've already had enough confusion throughout this whole pandemic. So I would support the board moving in that direction. And again, I thank everybody, and I thank the Board of Health. Jordana, you have done an amazing job rallying the troops, and we really appreciate your efforts and all of the public health staff effort. So I am going to be signing off because I need to run to another meeting. But Greg, thank you again, and I thank the public.
Thank you, Patty. It's my fellow commissioner, Patty Clapper. I'm looking for other comments here. If I don't see you, Tori, is that a hand up?
It is. It's also pointing to the square next to me, which on my screen is Bill Madsen. But nonetheless, I just wanted to chime in. I really appreciate Jeannie and Krista bringing that their viewpoint to the table at this time. You know, as I said before, the city council is in favor of rescinding the mask mandate. And we also, in our comments that I got back, were supportive of the schools having the ability to make some decisions going forward, but we also would support the rescinding of the mask mandate health order on the 22nd.
Thank you, Tori. And Bill, I'm sorry, I didn't see a hand up, but go ahead.
That's fine. Yeah, thanks. I really appreciate the comments. It's obviously, you know, divided our community a bit, and it's good to hear from the public. Make sure that we're open to those types of comments. It certainly is challenging. I think our biggest challenge is keeping the kids in school. I think that should be our priority. I want to make sure that we have the support of the teachers when we're making our decision. As Dave Boss said, it's difficult to gauge exactly what the teachers' responses have been. But I think, again, the important thing is to keep our kids in school. I mean, I have a whole new appreciation for masks. In fact, just wearing a mask protecting me from the sun and the wind, in addition to the virus, I think, you know, I think we all will have a different appreciation for masks going forward. And I think that we'll certainly be wearing masks in different scenarios and different environments going forward. I think we're living in a different world. I'm really of the mind that we should rescind the mask mandate. I'd prefer to do it immediately, but if the board feels that we need 12 days to transition, you know, I would go along with the board there. But I think that you know, at some point we're going to have to rip the Band-Aid off, and I don't know if a recommendation for the next 12 days would help us transition better than getting to the 22nd and saying, okay, we're home free in a sense. But I want to make sure that we're being consistent, and I support the schools and the mandate being dropped at the same time.
Okay, thanks, Bill. Just to summarize, you're saying perhaps it becomes a recommendation for the next 12 days, and that you want the schools to drop at the same time. I think that's what I heard. Thank you. And then I see Marky, and then I'll get to Linda.
I do want to thank all of the public for weighing in on this very important decision. I do think February 22nd for both the kids and the adult allows time for the communications to happen. So there was clarity in communication and implementation. The question that I would ask Jordana and team, what communication have you had with SCICO, where there are mask mandates in the restaurants and what have you?
Great question, Marky. So we've talked with SCICO, and their plan, if I can remember, is they will follow the mask requirements that align with whatever is required. They plan to continue their vaccination verification in the sit-down restaurants as well as in their hospitality. And they were still deciding whether they were going to strongly recommend or require masks for staff. And then, as I mentioned, since gondolas are not covered under the federal transportation requirement for masking, masking would be optional in the gondolas. And they will have additional options for the little mouse chairlift if folks feel uncomfortable with being with others of a different party.
Thank you.
I guess I want to interject here. I think I've heard from many people who are concerned that a transportation device like the gondola is treated separately for masking, and I know ski company has their reasons, but I'm going to ask. I'd like to ask them right now to open up Chair 5 also, so the people who choose not to ride the gondola can get up the mountain. If you're going to do it, and Chair 5 should be open. A lot of people would love to ride that. And you'll also see a lot of people who will not ride the gondola, I think, until they feel safe. Okay, I think Linda was up next.
Hi, I firmly believe in looking at the numbers, and I appreciate all the comments that were made today by the parents, and I wanted to cry along with some of those moms with the little children. I think that we just have to keep an open mind, and I think it's important looking at the statistics in our community and our high vaccination rate, and keep, maybe the focus being on getting more people to get vaccinated. But with speech development and reading people's faces, these young preschoolers especially, I think would benefit from not wearing masks, and school-age children, importantly. And it may change. I mean, if a variant comes along, I think that we have to be open to the fact that we might have to remask for a period of time, not forever, but for a period of time, and having that ability to switch back and forth if need be. But I fully support removing masks, whether it be tomorrow or in 2 weeks or March 5th, whatever we all agree to. I think I highly support.
Thanks, Linda. So just to make sure I can clarify, what you'd like to see it happen at the same time. You want to see the kids and the adult masks at the same time. I think, okay, I'm seeing it.
Yeah.
Looks like we're approaching consensus on that from our board. We might have some other people who want to weigh in, and I'm still looking. Pardon me if I don't see you here. Anne, any comment there? I see you there, but I didn't see a hand up.
No, I'm here. I'm in an airport too. So, no, I agree with what staff is proposing, and especially extending the mask in school until the 5th. And there was someone made a very good point that quarantine was quite damaging. And what the masks have done is decrease the amount of quarantine time for the kids. I still don't think we're out of the woods. I think we need to be more cautious than not. And so I agree with staff's recommendation and relooking at March 5th as that comes up.
Thanks, Anne. Okay, then. Tori, you've got your hand up again.
Yeah, I had a question. I was just trying to find again what the CDPHE guidance was going to be tomorrow.
Hi, Tori. I can speak to that. So I think that the CDPHE guidance will be very similar to the model that Eagle County has been using of transitioning to a disease control model, as opposed to investigating every case and contact. So we are, again, I'll just reiterate, we're very hopeful that the CDPHE guidance will come out tomorrow and have a direction to work in, even if it's not quite ready tomorrow, which sometimes they don't always meet their promised deadlines. But the model, Tori, to your point, I think the big point is that it is not requiring quarantine of contacts, regardless of vaccination status, as a primary control measure. So it's more looking at, are we seeing transmission? Are we seeing higher rates of absenteeism? Are we getting reports that multiple kids in the classroom are out sick with COVID-like symptoms, or having had tested for COVID, and then controlling further spread from that point.
Thanks for that, Jordana. Then Greg, I guess the comments that we've just heard is there's been a range of dates on this from tomorrow to Monday to the 22nd to the 5th for different various levels. So just want to make sure that we have that conversation.
Right. Well, the way I like to do this, because I think we do have some time now somehow. I don't know how we did it, but we leapt ahead on my agenda, which I'm so grateful for that. Thank you all. I think it's been a really good conversation. We've had some good points of view. I think what I would like to do in order to put the pressure on us is to entertain a motion by any one of our board members. Make a motion as you see fit, and if I can get a second on it, and then we have a conversation about it before we call it, is the way I would like to proceed. So if anybody has a thought in mind on how they'd like us to proceed, I'd like to hear that now.
Right, I just have a question. When is the earliest that we can drop the public health order?
Jeannie, I would just say, from the perspective of needing to completely rewrite guidance for how we proceed in schools without universal masking, and the fact that we haven't yet gotten that from CDPHE, the 22nd is probably the soonest we could get that, with working extremely hard and then communicating with all of our partners, and then for them to be able to share out to schools and out to teachers and staff and families what that would mean. I think that's the closest timeline to be able to make all of that happen.
Okay, I would like to propose a motion to drop the public health orders by the 22nd, or on the 22nd.
On the 22nd, and just while you're still making that motion, what does that include?
It's everything in the public health order, including masking indoors for the community as well as for all schools.
Okay, that's a motion from
I will second that.
Jeannie. I have a second from Dr. Kurt. Okay, further discussion. I saw some hands up. Let me just double check. Linda, did you have a hand up?
No, I was going to second it. Thank you.
You were going to second that. Okay, Bill, I see your hand up. You're muted. No, you're
Yes,
not.
just for further discussion, why don't you just outline for the public and for all of us what the dangers are, or what's the inherent problem with dropping the mask mandate as of today?
Thanks, Bill. Jordana?
It's mainly around, okay, I guess I'll back up. So what I've heard is that we want to drop the mask mandate for the entire mandate and have schools schools and the public go at the same time. If we did it today, we wouldn't have guidance for the schools to understand what would happen moving forward. So if we did have unmasked kids in school positive, we would be then quarantining any of those other contacts in school. And what we've heard is the main success has been being able to follow guidance that allows us to not have to quarantine. So for us to be able to develop that, share that with schools, and be able to follow that, we need some time so that that alignment happens, and we can continue doing what we've done so successfully in keeping kids in school as much as possible.
And that's the 22nd is that's really the minimum amount of time you need to do that, 10 days. Got it. Thank you. Bill, is that what you needed to hear? Okay. I'm still looking through my Jeopardy or whatever the Hollywood Squares thing here for all of you. Any other comments? I'm going to start calling names if I don't hear anything else. But I think most everyone's weighed in. Bill again.
Yeah, sorry, I just want to reiterate that regardless of what we decide, the TSA is not going to drop their mask mandate. So on public transit, it'll still be a mask mandate until March 18th.
That's a good point, Bill. Also, RAFTA is following the federal rules as well. So RASCA has been very successful with masking on buses, and I think our ridership is coming back up because people feel safe there. It's an enclosed space. It's not always incredibly well ventilated, tight quarters, and it's an appropriate place to wear masks. So we're not going to see a change with them either.
Yeah. Greg, I might be able to add in on that if you're okay.
Sure, John, go ahead. Yeah, nice to see you.
So masks will still be required in the airport through March 18th, as well as on RAFTA buses. We'll see if there's an extension of that requirement from the federal government. I don't think we've heard anything differently at this point. And so those facilities would still be masked. The only thing that this board, that I would offer, I think the 22nd for the schools, as Jordana has laid out, is probably a minimum timeline for what I'd call an orderly retreat from our public health order. You do have the President's Day weekend in there. I know Eagle County's experience when they dropped their mask mandate was that compliance really didn't work well over a weekend. And so if you wanted to take that into consideration, you might consider midnight on the 18th going into the weekend, which would probably buy time for the schools and maybe prevent some conflicts in the community, just confusion, frankly, as you're coming out. So I just offer that as experience that our neighbors had and shared with us, but I would not do anything or suggest anything that jeopardizes the minimum timeline that Jordana laid out.
Thanks, John. I know that you'd mentioned that, and I'd love to just hear, that is the thing. If people know it's going to drop, I think behavior will begin changing fairly rapidly. And so it's the practicality of that weekend. Are you going to need that weekend? Hopefully you won't need that President's weekend to be recrafting and organizing with the schools to get this thing ready and get it teed up. Do you want to have anything to add to that, Jordana? Just do we revise this to the 18th for practicality, or what do you recommend?
That's possible. My thinking was just based off of providing that mask through the holiday weekend, knowing that our mobility tends to increase on the weekends. Our partners, hospitality partners, also tell us that there will be people here that entire week, and then again right back in March. But we do know that that masking could be, the way I was thinking about it in the proposal is that it could provide some protection at least through that holiday Monday. And then especially, right, kids in the community, we know, well, they'll be coming back with masks optional on that Tuesday.
Okay, thank you. I appreciate your rationale for that, and I appreciate all the suggestions I've heard. I guess I'm going to ask Jeannie, you've made a motion. Do you have any desire to amend your motion, or is the motion going to stand as is? I'm inviting you to make a change, or I'm going to move it forward.
I'll go with whatever is best for the public health group. So sounds like the 22nd, but other people have other opinions?
Okay, we're going to keep the conversation open then. I'm pushing things along here a little bit. If I'm moving too quickly, please forgive me. But Dr. Kurt?
I agree with Jeannie, but I would also like to point out, I serve on the Wheeler Board, which met yesterday. And the Wheeler Board has elected, because people in an audience sit side by side with other people for 2 hours, that they might know, and there might possibly be a potential asymptomatic carrier, that people in audiences should continue to wear masks. And that's partly dictated by the performers that are coming into the Wheelers. Those that come in from New York, from Broadway, belong to an actors guild where it requires them to perform in front of audiences that are wearing masks. So the Wheeler and other entities can independently decide about mask wearing.
Great, thank you for bringing that up. That's true. There will be some instances where the entity that has a mandate may not even have control over it. Say the performers coming in may require it. So I think for this to work, it's going to require amount of respect.
Krista has her hand up.
Okay, Krista, I'll get to you. I see you there. I'm just saying that what I was going to say is that we really are going to have to focus on, maybe it's the Japanese way. We've seen Asian tourists wearing masks on airplanes and at their own personal discretion forever. And we may just have to accept that now. And I'm expecting our community can handle that going forward, but we will see cases where a mask is necessary. And since we've normalized it now, hopefully that's not going to be too big a burden for people. Krista?
Yeah, thanks. Actually, I wanted to kind of it was more of a question during the transportation discussion. I assume that school buses are also under the federal guidelines. So if the mask mandate expires at school, our children will still be required to wear masks on the buses? Yeah.
John, do you have that, or David?
Jordana's saying yes.
Oh,
Yes.
Jordan.
School bus.
Okay.
And then
Asking will be school bus.
the other comment just around figuring out this date is enforcement. Like going to the ski areas right now, you don't really see masks anywhere. Are we gonna, get into some battles over President's Day that we don't need to get into? I don't know. I mean, it's just kind of throwing that out there in terms of really looking at that date.
Thanks, Krista. Okay, I don't see anyone else raising hand. Those are good points, and I don't want to rush this. I think that the recommendation we've had from staff here is the 22nd. The pushback we've given staff is that it's going to be everybody on the 22nd. And I know there's going to be a heavy lift for the schools, for the teachers. What we're going to be battling now is a certain amount of stress in the community from unmasking. I feel it myself. I think about masking wherever I go, and it's going to be a little awkward thinking about not wearing a mask, especially if I don't feel quite comfortable in a crowded place or in a situation like that. So I think we need the time to do it. I think we have a motion on the floor to remove the mask mandate on the 22nd for kids and adults. And if I'm going to going once, twice, and 3 times here, nobody's waving a hand at me, but I'm going to call the question.
I'll wave a hand.
Great.
Oh, there you go. Great. Tori.
Sure, I'll wave a hand. I just wanted clarification. Did we hear comment from John Peacock that was talking about the 18th versus the 22nd for reasons of enforcement, compliance, etc.?
Well, we heard for practicality, thinking that, and I think we had a little bit of a counterpoint from Jordana, as I understood it, saying that, I think staff would prefer to go to the 22nd because typically during a crowded, highly mobile weekend like a President's Weekend, we have seen spikes in transmissivity and incidence rates, and this is an effort to try to to govern that. Is that correct, Jordan? I don't want to put words in your mouth, but that's how I interpreted it. I think the motion on the floor was the 22nd. I asked Jeannie if she would be willing to revise her motion, and I wasn't quite sure. I was under the impression you were okay with it on the 22nd. Okay.
And Greg, I just
John?
Just for the public record, I think the motion on the floor is to sunset the whole public health order. We've been focused on masks, but there are other elements. And so I just want to make sure that we're clear on the public record there.
Okay, well, because I have a certain lack of clarity on that, I'm going to ask Jordana to articulate just what we're rescinding on the 22nd, so it's clear. Thanks, John.
Sure. So we'll be rescinding the current public health order that requires masking for those 2+ event safety plans and businesses to communicate the Traveler Responsibility Code on 12 a.m. February 22nd, 2022.
Would anybody need more detail? Okay. Tori, come back to me.
Yeah, I just wanted to clarify as I'm getting input. My board is supportive of this action, but also would be supportive of the 18th, hearing what we've heard today.
Got it. Okay, I'm going to look around. It doesn't sound like if you keep raising your hand, Tori, I'm going to keep the floor open. I want to make sure this is fully hashed out. Bill or Marky or Dr. Kurt, if you had your hand up, I saw both hands come up. Was that exasperation, or are you just saying come on and get on with it? I just want to make sure that we've uncovered everything that we need to uncover here. And also, I just love hanging out with all of you. Were you going to say something, Dr. Kurt? You've unmuted.
Calling for the question.
Okay. All right. I think we understand the question on the floor. I'm going to call it. Everyone in favor, please say aye and raise your hand.
Aye.
All opposed? Okay, that we have a consensus on that motion. Thank you all very much. I know how hard it was to get to this point, and I also know that there's a lot of uncertainty. I also know, as Chris has pointed out, that I think it's, we can celebrate the incredible achievements that have been made regarding the COVID pandemic with vaccinations and masking strategies and everything that's been done to date. So we can all be forgiven if we want to celebrate this. And in fact, I'll encourage it. But I also know I'm going to be wearing my mask occasionally, especially when I need to. I might get back in a gondola again if I'm masked up and everyone else is, but I'm still thinking about that one. Okay, I'm going to move this right along. Thank you all for that. I guess the next conversation is next meeting date is going to be March 10th. That was our original plan before we called this special meeting. It's 3:27 now. If there's any other business, I'll entertain it for 3 minutes since we've got 3 minutes to kill. Krista, did you raise your hand?
I did. I just wanted to actually say one more thing about this, which is I do think this is time for cautious celebration. And I really feel strongly people should wear their masks if it makes them more comfortable. We've heard that a lot today. Masks work. N95s, if you have an immunocompromised condition, work even better. So this is not that we are dropping the masks. We're making the mask optional, but anybody that wants to continue to wear it, please do. And I just want to make sure that's very clear too.
Thank you. That's important. And I think that is very clear. I don't have anything else for you all. John Peacock, do you have anything you want to?
Yeah, I just would like to echo what Dr. Giesel just said. There are going to be a number of facilities in our community that still require masks because of the populations that are served or in those. Yeah, I think you'll find on the hospital campus, some county buildings, for example, our Schultz building, where we're serving vulnerable populations. So also ask everyone to pay attention and respect those requirements, because there's typically a very good reason that those will remain in place, even if they're not throughout the whole community. So just wanted to echo, thank you, Dr. Giesel, for bringing that up. And just to echo, this doesn't mean masks go away everywhere and are required nowhere. So.
Great. Thanks for that, John. Thanks for the reminder. Jordana, was there something else that you had? You're not unmute. Oh, you did. Okay.
No, but I can unmute and just say thank you, everyone, for having this conversation today and then making the decision. Just a reminder, not only will some individuals or buildings be making these decisions, but again, the urge for respect for businesses or, since the schools are not afforded a longer runway via a public health order, if your child's individual school sets a longer date for universal masking or any additional measures to be able to protect their school and in the step down wise manner that we're moving in. I think everyone that I've talked with on this issue really agrees that we're the goal of getting the masks off is a great goal, but there might be different speeds at which different folks in the community are moving there.
Thank you, Jordana. Yeah, I guess the final word may be, let's hope the entire community can appreciate that we've come out of this as far as we have, but then to respect the needs of the various groups who may still need to be masked. And moving forward, let's hope that we don't go back into a mask mandate or a more stringent public health order moving forward anytime soon, at least. Thank you all very much. With that, I think I'm going to adjourn this meeting. I don't know if I even need a vote. I see one vote at least. It looks like everyone's nodding their heads. So I'm going to say all in favor.
We do need a formal motion.
Oh, we do. I need a motion then. Who will move? Dr. Kurt, a second from Krista. Okay, all in favor of adjourning the Board of Health meeting. Well, looks like a consensus from here. Thank you all very much, and have a good afternoon. We're done.